So what we're really talking about is not treating autism itself, we're treating the comorbid psychiatric condition. So this is very different than everything else we've talked about today. Instead of treating the primary illness, we're going to treat the associated, the secondary illness. The primary illness is the autism, but we're treating the travels with. You really want to see, are you having functional impairment? And have you already done the behavioral and environmental changes in the school appropriate place first? We don't rush to medication. We make sure that everything else is stable, and then we add medication on. The other thing I would remind people is in autism, just like preschoolers, these people with autism and another disorder, tend to be more sensitive to behavioral and emotional side effects from meds, and they tend to have less tolerability. So if you've got a 8-year-old with autism and ADHD, you can't just dump in 18 milligrams of Oros methylphenidate or 10 milligrams of mixed amphetamine salts and roll on through like you could with a neurotypical kid. You may want to start a little lower. You may want to titrate more slowly. So that's always my caveat. So that pharmacologic intervention needs to be individualized. You need to sit there with the parent or caregiver and say, what are the target symptoms, right? ADHD has 18 core symptoms. Pick the 2 or 3 that the parent wants the most help with. That might be running out into traffic, like running without thinking where you're going, and use it and track the change as you make your intervention. Are we dropping that rating scale for those ADHD core symptoms that we care about? And remember to use it as an augmentation to your other interventions. You also want to rule out a medical cause of the behavioral change. So sometimes we'll see kids with autism who are screaming and head banging, right? So they're getting ready for an irritability with aggression, and you find out that they have an abscessed tooth or an ear infection. And the only reason you might know that is they have a fever or they're tugging at their ear. So again, physical examination by the pediatrician to make sure you're not missing constipation, teeth and ears. Those seem to be our 3 big ones in kids with autism that can cause behavioral changes.